Hi, I'm Garvin. This telecast is on Betnsol soluble tablets. So what is Betnsol used for? So Betnsol, or the chemical ingredient Betamethasone, soluble tablets can be used to treat a wide variety of diseases and conditions that require either reduction of inflammation or suppression of the immune system. These include severe allergic reactions such as anaphylaxis, asthma, rheumatoid arthritis, inflammatory bowel disease such as Crohn's disease or ulcerative colitis, inflammatory disorders of the kidney such as nephrotic syndrome and interstitial nephritis, inflammatory skin disorders, inflammatory disease of the skin and muscles, inflammatory disease called systemic lupus erythematosus, which can affect many organs throughout the body and is caused by the immune system attacking connective tissue in the body. Mixed connective tissue disease, rare condition involving inflammation in the walls of arteries, sarcoidosis, rheumatoid carditis, and cancer of the bone marrow, acute and lymphatic leukemia, and cancer of the lymph nodes or lymphoma, idiopathic thrombocytopenia, anemia caused by the immune system attacking red blood cells, which is autoimmune hemolytic anemia, and helping to prevent the immune system attacking a transplanted organ, for example heart, liver, kidney. Betamethasone soluble tablets dissolved in water can also be used as a mouthwash to treat mouth ulcers. This is an unlicensed use of the medicine. So how does it work? Betamethasone soluble tablets contain the active ingredient betamethasone, which is a type of medicine known as a corticosteroid. Corticosteroids are hormones that are produced naturally by the adrenal glands. They have many important functions in the body, including control of inflammatory responses. Betamethasone is a synthetic steroid that has an anti-inflammatory effect. It is used to decrease inflammation in various different diseases and conditions. Betamethasone works by acting within cells to prevent the release of certain chemicals that are important in the immune system. These chemicals are normally involved in producing immune and allergic responses, resulting in inflammation. By decreasing the release of these chemicals in a particular area, inflammation is reduced. This can help control a wide number of disease states characterized by excessive inflammation. These include severe allergic reactions, inflammation of the lungs in asthma, and inflammation of the joints in arthritis. So betamethasone also decreases the number of white blood cells circulating in the blood. This, along with the decrease in inflammatory chemicals, can prevent the rejection of organ transplants, as it prevents the body from attacking foreign tissue. It is useful for the treatment of certain types of leukemia, where there is an abnormally large production of certain white blood cells, and for treating certain diseases that are caused by the immune system attacking tissues in the body, or autoimmune diseases. So how do you take it? Betamethasone soluble tablets should be taken in the morning to mimic the natural production of corticosteroids by the body. The tablets are best taken dissolved in water, but can also be swallowed whole if necessary. They should be taken with or after food to minimize irritation to the stomach. The dose prescribed by your doctor depends on the condition being treated. It is important to follow the instructions given by your doctor and pharmacist. So for pregnancy and breastfeeding, when administered for long periods or repeatedly during pregnancy, corticosteroids may increase the risk of slowed growth in the developing baby. They may also cause the baby to make less of its own steroid hormones after birth, but this usually resolves on its own and rarely causes any problems. When used during pregnancy, betamethasone may also temporarily reduce the baby's heart rate and body movements. As a result, this medicine should be used with caution during pregnancy, and only if the expected benefit to the mother is greater than any possible risk to the developing baby. So seek further medical advice from your doctor about this. If you think you could be pregnant while you are taking this medicine, you should consult your doctor for advice. It is important that you do not suddenly stop taking this medicine unless your doctor tells you to. So this medicine passes into breast milk, it should be used with caution in mothers who are breastfeeding, and only if the benefits to the mother outweigh the risks to the nursing infant. Lower doses taken by the mother are unlikely to be significantly affect the baby, but if the mother is taking high doses for long periods of time, the medicine could cause the baby's adrenal glands to make less of their own natural steroid hormones. Again, seek medical advice from your GP about this. So the main side effects would be raised blood sugar levels, increased appetite and weight gain, increased susceptibility to infections, and increased severity of infections. The effects on the gut, such as indigestion or abdominal bloating, nausea, ulceration of the stomach or intestine, and inflammation of the pancreas, ulceration or thrush infection in the throat, muscle weakness or wasting, thinning of the bones, which is osteoporosis, and increased risk of breaking a bone. Effects on the skin, such as skin thinning, impaired healing, acne, bruising, stretch marks, increased sweating, change in pigmentation, increased hair growth. So there's psychiatric reactions such as mood changes, including irritability, depression and suicidal thoughts, psychotic reactions including mania, delusions and hallucinations, and anxiety, confusion, memory loss and sleep disturbances, and Cushing's syndrome characterized by moon face, menstrual disturbances, decrease in the production of natural steroids by the adrenal glands, and effects on the eyes such as raised pressure inside the eye, which is glaucoma, and cataracts, slowed growth in children and adolescents, hiccups, blood clots in the blood vessels, and these side effects I've just mentioned may not include all the side effects reported by the medicine's manufacturer. For more information about any other possible risks associated with this medicine, please read the information provided with the medicine or talk to your doctor or pharmacist. So how can this medicine affect other medicines? It is important to tell your doctor or pharmacist what medicines you are already taking, including those bought without a prescription and herbal medicines, before you start treatment with this medicine. Similarly, check with your doctor or pharmacist before taking any new medicine while taking this one to make sure that the combination is safe. Betnsol may increase blood sugar levels and so may oppose the blood sugar lowering effects of anti-diabetic medicines. People with diabetes may need an increase in their dose of insulin or anti-diabetic tablets. Betnsol may enhance the anti-blood clotting effect of anticoagulant medicines such as warfarin. So people taking anticoagulant medicines in combination with Betnsol should have their blood clotting time or their INR regularly monitored, particularly after starting or stopping treatment with Betnsol and after any dose changes. If Betnsol is used in combination with non-steroidal anti-inflammatory drugs such as ibuprofen, diclofenac or naproxen, there may be an increased risk of side effects on the gut, such as stomach ulceration and bleeding. Betnsol may decrease the blood levels of salicylates such as aspirin. When Betnsol is stopped, this may result in excessive levels of salicylate unless the dose is readjusted. So the following medicines that I'm going to name may increase the removal of Betnsol from the body, thus reducing its effects. You may need a larger dose of Betnsol if you're also taking any of these medicines. So the barbiturates, which would include phenobarbital, carbamazepine, phenytoin, primidone, rifabutin, rifampicin. And the effect of corticosteroids may be reduced in 3 to 4 days following use of mifeprostone. Betamethasone may decrease the body's immune response. This means that vaccines may be less effective if given during treatment because the body does not produce sufficient antibodies. So live vaccines may cause serious infections, and live vaccines include measles, mumps, rubella, MMR, BCG, chickenpox, shingles, oral polio, oral typhoid, and yellow fever. These should not be given to people whose immune system is underactive due to treatment with this medicine. Corticosteroids can cause fluid and salt retention and so may oppose the effect of antihypertensive medicines used to treat high blood pressure and diuretics, for example furosemide. However, Betnsol is much less likely than other corticosteroids to have this effect. So if you have any questions on Betnsol, you can contact me through the live pharmacist on the website. You can email me, or call into Lynch's pharmacy in Cork. Thank you for watching and have a nice day.